this computer. Okay, we are on recording right now. Okay, so I would like to extend my appreciation and thanks to all of you to be here. We are a group of professionals who are working, I created Canadian National Health Campaign, we call it C.N.H.C, and from Bioquantum Academy, it's a mass educational platform for the public. And we're trying to educate people across Canada from west coast to coast. And I have a pleasure of collaborating with Dr. Menon with the Bowen College as well from West Coast. And also I'm just hoping that I can have more collaborators. I think Dr. Steve is going to be one of them, and we're going to have international collaborators with Canadian National Health Campaign. For some people who don't know me, Dr. Parvin Zarrin, the founder of Homeopathy Nutrition Clinic, founder of Integrative Medicine and Nutrition, and founder of Bioquantum Academy in Canada. I'm a practitioner, educator, and author of a Quantum Anti-Aging book. If you want to know more about me, you can visit my website, www.bioquantum.ca. Again, I would like to have a special greetings from C.N.H.C team to all Canadians from coast to coast. We are here to share our views and perspective from domain of natural medicine. We are having different, practicing different modalities. Actually, this domain is versus the mainstream allopathic model. So this platform is for whom? For people who want to overcome their health challenges naturally and effectively without using suppressive methods. We are here to provide you information, correct narratives, and answer to some of your unanswered questions. So I would like to talk a little bit of frustration that we all went through globally and also as a nation in Canada. I think Canadians, myself, Helen, Lamont, Dr. Menon, and Dr. Grant, Alish, Joan, we are all Canadians. We experience the historic discrimination, segregation, and exclusion in our society by the authorities' mandates for vaccine choice in the past couple of years, which has cracked the foundation of our unity. But we are here to tell our nation we are operating as the nation under one umbrella. As Canadians, we do not hold grudges against our own people, and we are here to give you right and correct information to help you to heal yourself. We are practitioners under oath to help, but not to harm. That's why we are here as a C.N.H.C, call for unity. I'm not saying uniformity. We will never be uniform in society, but unified, no matter the choices you made, no matter vaccinated or unvaccinated. The choices is yours. Views and perspective is yours. But as a nation, we like to come together and be unified, because no matter what choices you made, you can be your own healer and heal yourself. So we have not tried that. We have faith on what we do, and even though might be different views from different practitioners, but we are in the domain of natural medicine because nature never lies. So as I said, we are here to share our views and about the healing, and I would like to walk people through the journey of health and healing with all of you, the professionals and practitioners today. So as I always say, biology science discovers the nature of matter, but it does not create nature. So I would like to pass it to another professional to speak, and then I will continue. So whoever wants to go first is the pleasure to be first.
Okay, I'll go ahead. So
Okay,
my name
yes.
is Manon Boliger. I've got to correct the doctor piece because that belongs to a professional body, which I was part of for 30 years. But because of the specific angles it has taken on this issue, and because it has not, as a body, really protected nor its practitioners nor the public, and has not held the oath of do no harm, I cannot be part of that organization anymore. And so I have deregistered completely. So I need to correct it. I am no longer a doctor. I have the knowledge of all of that. And really my passion has been for the last 30 years to educate people and to really help people understand that they are the ones that do that actually does the healing. We're guides on the path, but we are not the healers. People are the healers, and you make choices by the understanding you have, the education that you receive. So, the more things you read, the more people you find out, the more case studies, or, when people say I got better and I don't know how, find out how, because maybe that will be the right path for you, right? So the idea for me is really to be empowered. That is the journey, and it was my particular journey myself as well. When I was diagnosed with stage 4 cancer, I was already a full-fledged naturopathic doctor, but it isn't. I had to find my own path to the healing journey, right? So it's very individual, and so I wanted to speak to that. The other part of my practice, and I am the founder of Bowen College, which is a college that teaches a holistic perspective on healing and includes in it a physical therapy called Bowen therapy. It's spelled Bowen, because my understanding is that it takes mental, emotional, and physical components, not just cellular biological, which is essential as well, but touch is very misunderstood in its impact that it has on the body, and can be sometimes, for some people, the missing link. So that's a little bit about me, and I'm very excited to be part of this this organization to spread really the truth about our incredible strength as human beings.
Thank you, Dr. Manon. So, Dr. Grant, would you like to go next?
Thank you, Dr. Parvin. It's a pleasure to be here with you and all of the privileged and honored guests here. And yes, I'm Dr. George Grant from Richmond Hill, Ontario, neighbor of Dr. Parvin, and just north of Toronto. And I had the pleasure actually working virtually with Dr. Manon and help her clients virtually through my newest biofeedback scan called the Voice AO. AO stands for Alpha and Omega. It's a voice scan. Some of you have experienced that. If not, go to www.academyofwellness.com and book your virtual free session with me. I'll be happy to help you with that. Okay, I'm going to compress 50 years of experience. Yes, I'm 72. I know I look much younger. Thanks very much. But I'm going to compress 50 years of work in almost like maybe 5 minutes. So I started my career at age 18 years young. My mom passed away when she was her early 40s. Heart disease, diabetes, blood pressure. Same with dad, early 60s. Never seen my grandparents. So at age 18, I decided to find out how I can prevent diabetes, how can I prevent heart disease and hypertension naturally, not with medications, not with surgery, not with any of this invasive stuff. So that's when I started my career at age 18 years young. So I actually earned 3 doctorate degrees, the first one from University of Toronto in 1995 in psychology, specifically in stress management. And after this, I earned the other 2 doctorates, integrative medicine, functional medicine, lifestyle medicine, and also humanitarian medicine. I travel all over the world to do humanitarian work. And so basically, that's what I only have 3 doctorates, 3 masters, and 3 bachelor's degree. I've written only 250 papers. I've written 20 books, and trying to help my clients all over the world. I only have 25,000 virtual clients, and also I see them in person in Toronto here, all over the world. I was the first scientist in the world to isolate beta endorphins at the Faculty of Pharmacy and Medicine in Saskatchewan, Saskatchewan. And of course, there are 2 other people who did work with me on this, Dr. Wayne Hindmarsh, he was the Dean of Pharmacy at that time, and Dr. Sankran, he was the head of the neonatal units at the Faculty of Medicine in Saskatoon, Saskatchewan. So in 1981, we were the first people to isolate beta endorphins in humans in vitro and also in vivo, in kids who have SIDS. I was also the first scientist to speak about type 3 diabetes called dementia. I was the first scientist to do lots of other things. I don't have time to go through all my bio. If you want to go through my bio, academyofwellness.com to see what I've done in 50 years. I agree with Dr. Parvin when she said about all of what happened in the past 2 years. I did actually work for Health Canada, the FDA, and the CDC. Since this call is recorded, I'm not going to say anything about this organization. Yeah. But all I can tell you is this. I do not quite agree with everything that I've seen there in the past 10 years I worked with them. Everything is good. Everything's fine. There's no big deal, no big problem. The only thing that I only focus in my career, I done allopathic, I done the pharmacy and medicine, I done all of the stuff. I specialize in toxicology and pharmacology. And then now I specialize in biofeedback and stress management. And I do lots of work with my clients to help them to focus on prevention instead of intervention, to focus on self-care instead of crisis care. I do not agree that any physician in the world, even if they're Albert Einstein, to fix anybody's problem in 5 minutes or 7 minutes and end up with prescription. So I have no axe to grind against my colleagues who are physicians. I've written books with them. I've written lots of stuff. But what I believe in is the prevention. In fact, I'm just going to take 1 minute to show you one client. He came to see me through Sunnybrook Hospital. It's one of the hospitals here in Toronto. And I don't work for the hospital. I'm not a cardiologist. I'm not a physician. I'm only a scientist. I told you my PhD is University of Toronto. But I was referred to this person here through one of my co-authors. He said this person has done 2 bypass, 2 stents, and he's taken 28 medications. Now, if you know anything about toxicology and pharmacology, this is a big challenge here to even identify the toxicity of those medications. And he had 99% clogged arteries. And the dates here in 1998. Okay, so he was almost gone to hospice to die in 1998. In less than 9 months, I helped him through natural ways, through biofeedback, to reduce those medications significantly to none, basically through his own cardiologist, no bypass, no stents, and he is 50% open. By the way, he's still alive since 1999 today till 101. So I did not write this book just to brag about me want to live till 101. I helped so many clients who are able to live this age. I helped somebody in British Columbia. I traveled all over across Canada, across the US, who had 100% clogged arteries. I don't have time to explain to you all of the cases that I've seen, but it was a pleasure to work with Dr. Parvin. I'm very happy to collaborate with her and Dr. Mano and everybody else on the call here to help our clients here to focus on prevention, not intervention, self-care instead of crisis care. So our motto is we care, we serve, we educate. We do not medicate, operate, irradiate, amputate, vaccinate, any of this stuff. We don't do any of this stuff. Okay, so I'm happy to answer any questions. Again, go to www.academyofwellness.com, email me. We can collaborate all of us together to promote wellness worldwide and to do all of the good works that each one of you are doing silently, but sometimes in vacuum, and nobody else know what we are doing here to help people. Thank you, Dr. Parvin, for the opportunity.
Thank you, Dr. Grant. I appreciate it for being here and share your views. So we know you already, and yeah, that's a great platform that people are going to know you more. So Dr. Steve, would you like to share your view?
Sure. It's a pleasure. I wanted to thank all of you for inviting me, Dr. Parvin, and for having me on board. It's my first time with Canadian National Health Campaign. And I live in Europe. I was born and raised in New York. I have many specialties, as many of you. I am a naturopathic physician, and I started back when I was in the University of Genoa for medicine. I wanted to be a oncological surgeon for reasons of my past. And my mentor one day sat me down in front of him and said, "Look, Steve, let's get one thing straight. You're not going to cure anything as a surgeon. You're going to take it out or put it in, but you're not going to cure anything. So I want you to sit down because you're at your 6th year. This is going to be hell come high water, and you have to make a decision. If you keep talking about trying to heal, you're in the wrong place." So at that point, I made a decision which made everybody in my family very unhappy, to become a naturopathic physician. And for 30 years now, I've been doing it. One thing that I must say that I really appreciate, besides learning from every one of you, is the fact that we are bridging, according to me, a fundamental gap in our society, which has to do with education.
Yes.
We are educated in medicine. We are educated in taking care of a sickness. Now, I have a specialty in traditional Chinese medicine, and in Chinese medicine, they say cure before it appears. And that is pure prevention, like you were saying, Professor George.
Yes.
And through the years, I've done many, many things. And through the last 10 to 15 years, I've been working basically with herbal medicine and especially essential oils. I firmly believe, like Plato said in his ancient times, you cannot cure a body if you not cure the mind. And for Plato, the mind was mind and soul. So even in natural medicine, it's useless that I just give drops of taraxacum or just give them some drops of an essential oil if we do not spend the time with the person to make them understand where the origin, which is basically, I don't want to be an absolutist, but 99.9% of the problems start on an emotional basis, and we ignore them, and they grow and they grow and they grow like weeds. And we have to figure that I'm 65. And if I ignored my villa that I've been building for the last 65 years, and I ignore the garden's going to be full of weeds. You're not going to be able to come through the front gate. I'm not going to be able to walk around. So that's exactly what's happening to our bodies. Plus, when you were talking, Dr. Parvin, about what happened in Canada within the last couple of years, without saying any specific event of a name, this has happened throughout the world. It's happened in Europe, where they even denied the fact that it's going to help, but they had people work on various areas that have to do with medicine, vaccines, and whatever. But nobody took any care of, like Dr. Manon said, the missing point. For 2 years, we isolated people with no touch. For 2 years, there was no exchange. For 2 years, we weren't even able to go and see our loved ones in a hospital. Now, that has an outrageous emotional account, and that will increase. One thing which I believe in is called inflammation. The inflammation in our body increased by endogenous factors inside of me or exogenous factors outside of me are what is, I would say, is like the water on a sand that just keeps ripping away the sand and washing away all your bases. So this is one thing that I've been addressing, and I work a lot with geriatric patients with dementia, Alzheimer's, and other disabilities, plus also with autistic children. And when you were talking about touch, touch is fundamental. I remember back, way back, I wasn't even born. If I'm not mistaken, it was in the 1920s in New York. They did in various orphanages in New York, they did an experiment because one of the leading doctors at the time, and there's a video out on YouTube that you can reach out and look at, that you're not allowed to touch the children because we don't want them to have expectations. We don't want them to have an emotional problem. So what happened was, this went on for a couple of years, and the children started dying. No diseases, but they started dying. In one orphanage, they reached a 99% of death. And it all led back to the lack of touch, the lack of human interaction. And this is where I think allopathic medicine has lost it. We do not explain. And what is very, very funny, I mean, I come from a culture like all of you, and we talk about antibiotics. Now, the word antibiotic comes from Latin, anti-bios, against life. So what we're doing is we're giving people legally something that is against their life. And this is the absurd thing. And then they ask us to, swear that we're not going to harm. And this is just one little aspect. And I think that it's not a question, and I personally believe in complementary integrated medicine. So there are times when you need to do and to interact with certain things. But I certainly believe that the educational part of our effort is a fundamental. And that's what I like about participating in all this, besides all the knowledge that we can bring in and we can access, and we can talk about the science and whatever you want. But people must start to understand that life is their choice. They choose every single day, from the minute you sit at the table or you get up in the morning, on what is going to be their future. But the point is, they are ignorant. They ignore the basics. And many of us have seen the most craziest things, I think, in natural medicine out there, saying, you do this and you're going to be fine. You do that, you're going to be fine. And natural medicine has been divided. We're not looking at the entire system, holos. We're not looking at Steve with his disease or his problem. We're looking at the disease of Steve. And it's a totally different outcome. And if you explain to people, and I come from cancer research, and I worked for 4.5 years in pediatric cancer institute in Italy at the Giannina Gaslini, which is one of the biggest pediatric hospitals in Europe and one of the biggest in the world. And when you talked to the children, it was amazing, because they would sit down and they would talk to you about their problems, saying that that is what is causing them to have cancer. But we had a big problem. 98% of the doctors were deaf, and they couldn't read the lips. So I think that this is a fundamental event, and I am more than happy, and whatever little knowledge I have, I'll be more than happy to share. And I appreciate all of you for having me here.
Wow, thank you, Dr. Steve. That was great. What happened to Parvin? Is she
Oh,
still
she
around?
disappears.
Oh my goodness, that's
Yeah.
what. Oh wow, eh? She got kicked out. Oh dear. Oh dear.
There she is.
Yeah.
I've
So.
not disappeared. I'm just moving around to find
I
a good
know.
Oh,
spot.
there she is.
I can speak. I
Yeah.
don't know why this happening today.
Oh,
So,
I can share with Zoom, with other
yeah,
Zoom
Helen,
calls.
you
So
go. You go next.
yeah,
Please, you go next.
yes, I was gonna share that, there's something going on with Zoom calls. Like, this is not the only issue here, but many people throughout the weeks and prior to, they're having issues. So I've been on Zoom calls this whole week and they've been on and off. So that's why I'm using my cell. I'm like, I can't see everybody on one screen, unfortunately. I have to swipe here and there. So don't mind me. Um, my name is Helen, and I'm very honored to be a part of seeing Dr. Steve come in and Dr. Grant and Dr. Manon, Manon is back on here, and Dr. Parvin as well. I'm very humbled as well. I haven't practiced as much as you doctors have, as I'm homeopath, graduated with the Dr. Parvin. I went into the field for a few years and it didn't go the way that I would think it would, because there was a lot of education that had to be done. And not a lot of people understood what homeopathy was. They think, oh, are you a naturopath? I go, no, I'm not a naturopath. I can tell you what it is. So it's very different modality, different approach. So I sort of put that aside, but I still have it within me to know what to treat and who and how to help people as they need to. And from there, I learned from the school. I learned another modality called the back alignment treatment, which was originally before the chiropractors changed it their way, more structural and manipulating which should not be. It's basically touch, like bowing, it's just going through the meridians to clear the meridians so the individual can heal the body. They can actually heal themselves, right? And then I got into Reiki. So I'm a Reiki healer. And most recently, probably about last year and a half ago, I actually got a certificate in the field of the, what's it called? Like quantum bioenergy healing. So it's a mixture of different ways of looking to the organs and clearing. It's similar to, Reiki and Bowen in a way, in regards to clearing all whatever the modalities is, blockages within the head to bottom, right? So that's what I've been doing. And yeah, has, in the natural field itself, has always been my calling. I've rarely took any allopathic medication, Tylenol or whatsoever, but only when I do need it, but that'd be rare. So I grew up being in a household that uses, my parents, they use a more of natural herbs like Chinese medicine. They learn themselves that way, and they continue to do so today by learning, and listening to certain educators that tells you how to use certain things, and they themselves go and see their own doctors, by using Chinese medicine. So that has been in me in that kind of way to go more natural. And I believe the whole being of me is like, with the chemicals and everything that has been combined in with the conventional method, is harming our organs, and it is slowing down our blood system, slowing down our cognitive thinking. And this is what's happening within the 2 years, is they're actually inoculating a lot of people so that they will not be able to think properly, get into more fear-based, to perpetuate this whole fear that's been going on for 2 years, right? We had a firsthand, Lamont and I, we had a firsthand experience because we were the ones who were boots on the ground with a few other people to go against this mandate, because we knew. I never protested it in my whole life, right? And then I was called to do so while at that time I was still working a full-time job as an inside sales representative for a well-known professional brand company. And I had to let that go because just I'm like, I got all tensed, and then all of a sudden in my mind when go resignation, I'm going, okay, resignation time. So that took place, and then for the almost 3 years now, we've been out there educating people, helping people, be the people of inspiration and reverse the fear and help people to understand and how to help them reverse their own fear as they're going through this. Because when initially we went on the grounds, a lot of people came out. They're like, my parents is disowning me, and they think I'm a quack, and I feel this is so wrong on the body level and what they sense. I give them a big bravo, to really stand up and come out, against the norm, because we've all been, every one of us, regardless of what age factor, where we are today. But the choices that we make is the choices that will help us to bring more clarity and more light to people who we come upon, so that we can teach them, we can, educate them, help them in any kind of way that we know, because we have an inner knowing, to be who we are, to step into who we are as we are today. Because as we go through this, there's going to be more that's going to come out, and they're going to be looking for us, and they're going to be, looking for, some clarity and sort more like disclosure upon their own end, to really know what truly took place. So I guess we're all jumping on boat and willing to do that. And we're not, and as we took our oath, at that time, we all were in the heartfelt mind to take that oath to do no harm. And I still hold that till today. And there's a lot of people who don't understand why we do what we do. It's not for them to understand, right? And I find that it's for us, our own selves, to understand why we do what we do, and we work on it and understand whatever there is that we need to work on to better ourselves so we can help other people. Yeah, thank you for this opportunity. Yes.
Thank you, Helen. That was great. Yes, now by Helen introduced herself that they were running protests during the past few years, and it was a pleasure to be part of them for a couple of times, to present at the rallies. And we fought against wrong. They stood for rights. And at this point, the whole world knows that whatever they call the vaccine is a gigantic lie. It was deception. It was corruption. The whole world knows. And whatever they said, it was a lie. We never got herd immunity by artificial inoculation. I don't know, the Canadians all will remember the state of emergency, declaring the state of emergency, martial law, lockdown, curfew against the virus, creating red zone, blue zone, green zone, the very discriminative social distancing, creating so much fear, anxiety, oppression, and division, exclusion, violation of the medical choice, violation of medical privacy, violation of our Charter of Rights and Freedoms that we chose this country to be our home because of that, because of the Charter of Rights and Freedoms. And in general, violation of human rights and across the world. So now I have been fighting for medical choice the past 22 years. All of us, knowingly, unknowingly, in the natural medicine domain, we have been fighting for the truth. We have been fighting for the truth of healing. So, but this artificial inoculation is a war against the human constitution. So the cheating on nature, fooling the mother nature, and ultimately the immune system destruction. If Lamont and Helen knows about the presentation that I had in front of the police station in Toronto last year, exactly last year, this time, and I talked about it, this artificial inoculation, I don't want to call the other name. I'm afraid that YouTube is going to bring me down, but I use them interchangeably. It's based on the scam science. It's based on lies. It's based on fake narrative, false information. And anything that is made by fraudulent pharma, mandated by corrupted governments, and advocated and applied by a suppressive mainstream model, it's a debt installments. And now the whole world knows what's happening, what's going on. But still, they're sticking with their fake and corrupt narratives. But we have, as people, that we are advocating the health and healings for people, we should keep reminding it that real vaccine, this is not a vaccine. Real vaccine originally was made from homeopathic nodules, according to the true science of homeopathy, because producing a vaccine has laws and principles. These are laws of isolation, laws of dilution, potentization, and Arnschult's law. These are laws that they have to be followed if they really want to help the immune system of human beings. But none of them is being followed. Everything is being violated. So that's why we are here. That's why we are here to introduce, to talk about it more and more. We have been doing it the past 22 years personally, and I'm sure you have done it. And the past 3 years, non-stop, we talked about it. Lamont and Helen, they ran the rallies, and God bless them. They worked so hard, and we try to educate people. And at this point, at least Canadian, they have come to their senses. They understand what happened to them, and that's why we want this platform. We already creating future healthcare. You know, we are not established in that way, but we are bringing it to people's home. Because we always believe that healthcare starts from your home, from your own kitchen, from what you're putting in your body. Sick care, disease management, the way that allopathic model, the mainstream, has been doing it the past 125 years with synthetic and artificial drug, is a failed methodology. They know they have already failed, but unfortunately, they're still sticking with their fake narratives. One thing that I would like to know and to tell this model, nature never ever allows any human beings to come to existence without giving them a defense system, without giving them a bodyguard, without giving them army. It's called the immune system. Human being is born with passive immunity, has innate immunity, has adaptive immunity on its own. It's a very sophisticated system that nature is endowed in all human beings. So what do we need artificial inoculation? It's a question that I would like to ask from the current and dominant model. Why you are vaccinating infant 1 day old? Why you are vaccinating the 1 day old baby? When the nature gave them passive immunity, innate immunity, is just a question. That's why we are here to tell people, listen, you are not born without defense mechanism. You don't need anything from outside world. You just have to understand how the immune system as a whole, as two major subsystems works as a whole, how this these two subsystems collaborate, communicate, and cooperate together. That's why we are here to teach people what the immune system is. To my knowledge, 92% of Canadians got this artificial inoculation. To my understanding, that nobody has faith to their immunity. Nobody has faith that they have the system that the nature is endowed in them. I think somebody wants to talk, and I'm going to stop here.
Can I say something?
Yes, Dr. Steve, go ahead.
You know me, Dr. Parvin, and I'm very straight out, and that's why I have been kicked out of many, many conferences.
I know.
You want an answer? It has nothing to do with medicine.
We're all going to have answer, definitely. I'm going to go around and I ask everybody's answer.
Is very simple. It has nothing to do with medicine.
No, you're right.
It's got to do with economics.
Yes.
When I was in the pediatrical hospital, I was amazed by the fact that if a child, and I'm not talking about an oncological patient because they're very delicate and whatever, but mothers would come in with the kid, he has a cough, starting a fever. Oh, well, let's give him an antibiotic. Now, way back when, more than 40 years ago, I remember somebody telling me that a fever serves to create antibodies. So what are we doing? We're making sure we're going to have sick kids and sick people and people with a low immune system so we can continue an economical basis in frauding the people, because this is the baseline. Now, what I've been trying to do with the people is getting away from why, but telling them how you can do. How I had a wonderful pediatrician when I was a child back in New York. She was a doctor who came in from Austria, and she was one of those real strong doctors. And I suffered from tonsillitis, so you can imagine the fevers I had. I remember she refused. She gave me an antibiotic once because she wasn't able to control the fever that hit 41 centigrade. And she said, give him an antibiotic. Since then, I have to say, I have, for the last 36 years, I think maybe I took medicines twice in my life. Now, the whole thing is, when you were talking about teaching the people, what I love about this community is that nobody is a fake. And I don't know your situation in Canada, but I can guarantee that the situation here in Europe, there are people who know absolutely nothing. They get a degree in 9 weekends for 2 years in naturopathic medicine, where I studied for 4 years in a university. I must be stupid. They must be very, intelligent. And they are treating the people in an allopathic method, trying to use natural medicine.
Dr. Menon knows about this.
Yeah, I can imagine she knows about it. I can imagine all of you know about it.
Yeah, it's been a lot of change in regulations, and since the government got their hands on in regards to certain, certain health fields like naturopathic and homeopathy, I never registered with any organization because I knew that there's something wrong. Because if we're going against each other and not to help each other and grow, how is that gonna work? So yeah.
And then I just
the
have
problem is that the whole medical system is monopolized by one mainstream, one allopathic model, a suppressive model, and there is no chance to give to. That's why maybe and also Dr. Steve, naturopathic colleges are from pharmaceuticals. I'm sorry about that to say that. But naturopathic college in Canada is established by pharmaceuticals.
I know.
Because they realize the natural medicine industry is very profitable. Supplements and all those things is very profitable. And they brought it under umbrella of pharmaceuticals. Their diploma comes from pharmaceuticals. That's why Dr. Menon had to deregister.
I know.
Because practically she was against their constitution.
And one thing, when you were talking about the immune system, Mother Nature has made us live for a couple of billion of years as animals and bacteria and all the rest. And are many people so blind that they think that we are going to be able to control all of this? We can help. We can we can decide on, in Native American culture, there's the saying of the two wolves, the black and the white wolf. And the grandfather talks about the traditions of the black and the white. And the grandchild says, well, Grandpa, who's going to win at the end? It depends on who you're going to nourish.
Yeah, I love that one. It still sticks in my mind in regards to going forward. You have a choice, right?
Right.
Always
And-
make the best decision.
And this
Yeah.
is why I'm very proud and honored to be in this group, because we're trying to help people make their choices.
Absolutely. With
Thank
every
you.
choices the people make, we have respect and tolerance, but it's our responsibility to help but not harm, to educate, no matter the choices they make in their lifetime. But one comment on Dr. Steve about fever, as you know, the homeopathy perspective on the fever and any form of innate immunity responses, that we encourage fever
I
in a
know.
very healthy way. For example, in babies, we give them belladonna or aconitum to encourage fever, because fever is the response of innate immunity of our first line of defense. It's a patrol border of the innate, immune system. That's why in homeopathy, instead of suppressing
Exactly.
it, which allopats do, we encourage it with the best system of medicine in a healthy manner, healthy process. That because we know, as we know, temperature is killing all different kind of pathogens, and the human body is born with that ability.
Of course.
And unfortunately, from day one in the hospitals, they inject the babies. Dr. Grant knows about this. Inject baby in a couple of hours of their birth, that is suppressing their passive immunity, the innate immunity, and goes on and on. And then now they say the healthcare system is collapsing. It's already collapsed. You're just holding it with your power. There is no health care. This is sick care. We don't need sick care. We need to teach people to take care of themselves and to heal themselves. We just have to give the mechanism, the tools. That's why we are here. So I would like to pass it to Dr. Menon. Maybe she has to leave, and then Dr. Grant. So Dr. Menon, go ahead.
Okay, yeah, I was just looking at the time, and I definitely want to give a resource. It's a set of different videos by Dr. Trozzi, who explains very well the difference between innate and adaptive immune system. And I think, one of the biggest misunderstandings, it was deliberate, obviously, what was to be understood, but is the idea that we actually are dependent on some outside source for our immune system to work. And that is the biggest lie. We need exposure to our environment in order to make our own innate immune system work. That's the nature of our innate immune system. And most of the cells, like the macrophages, the natural killer cells, the neutrophils, the dendritic cells, the eosinophils, the basophils, all of these cells, right, are in our body. They're available to us. And whether we have the villi when we breathe in, or we have so many, our whole body is covered by an immune system that is there to react. And the worst thing we can do is bypass this natural immune system to go to, so-called the production of antibodies, especially if the antibodies are not even neutralizing. And never mind this last fiasco where the pathogen is actually the toxin that is causing massive human harm. So I just wanted to give that as a background context. But if I'm going to share my screen quickly here, I think this is going to work. here we go. So this, if you go to Dr. Trozzi, spelled so DrTrozzi.org, he has a section in library, which is massive. And if you just put in the word immune, and then this, you know, to find it here, whatever that's called, the Q, he starts here with how the COVID, I'm not going to say the word, but he's got it under quotations, cripples the immune system. So he starts by an understanding of the immune system so that you really have that background, so that we have the right terms to understand. And this is, it's not complicated. We just are so complexly, beautifully made. And he does explain it very well. And then it goes into part 2, 3, 4, and 5. And he explains the mechanisms of the destruction of the immune system by the repetition of these, I think they're bioweapons, so I'm going to call them as they are. And it's really, it's a fantastic piece of work. And if you go to his general library, oops, let's see if this will turn for me. Yeah, he's very, did it change? Did the page change? Yes, it did. Okay. Yeah, he talks about so many different things, including in Canada here, 80 Canadian MDs that were boosted and died, which is, it's just a tragedy to understand how the narrative was so powerful, and also the training of our medical doctors has been a brainwashing for so long that, you know, well-meaning doctors have fallen for this. Not everyone has been paid off. You know, people actually believe that they were doing the best thing, and they are dying, and nurses are dying, and tons of people are dying. So I think it's really important to understand the history, and that we work together for the solution. So anyway, there's lots. He has so much. It would take the whole day to go, well, several days to go through all his articles, and everything is researched, and you can look at the actual sources. So that's what I wanted to share with everyone.
Thank you,
Thank
Manon.
you.
That was, yeah, that was good. That was good. Before Dr. George speak, is it possible Parvin Lamont speak as well? Because he's probably has something to say, like to share.
Oh,
Thank you, Dr. George.
I thought Lamont wants to have just joke today. So of course, Lamont, go ahead.
Oh, thank you, Helen. Thank you, Parvin. Manon, were you done? Were you done? Your
Dr. Manon left because she's flying to Toronto tonight.
Oh, I see. Okay,
Yeah,
cool.
she's going to be here in Toronto tomorrow.
Good. Well, I super appreciate that. And number one, thank you for the opportunity. One of the issues is, number one, is that I've been a very honest person as of late, because I figured that because of this latest agenda that's been happening in the last 29 months now, is that people showing their true colors is really the currency that we all need to spend. And being able to speak in a way where we have this, Canadian National Healing Campaign is that, such as the doctors had said, is that bridge between what we've been led to believe has been our ways of healing, depending on the allopathic models, believing in the authority that tells us that we don't have this innate way of healing ourselves, is the only way to go, while shunning and destroying the more natural ways of people being able to heal themselves is truly my mission in this world. Even there we go, unmute myself. I don't even know where I left off. See, what they do now recently, and this has only been happening since I started using computers when I was part of this resistance movement, is that now they play with my mouse. So they click it on me all the time. And I'd like to say it's part of the same reason why they're playing around with Zoom calls and booting people out of their own shows. So what I'm trying to say is that from the history of where I've come, from nature, where I grew up as a small kid in New Brunswick, is that I quickly learned, now that I started paying attention at the past, even when I couldn't pay attention as a young person, I was always able to see certain markers in my life of how certain people in my life lived their lives, how they acted when they exercised versus non-exercise, how they acted when they meditated versus non-meditation, how they worked out when they ate more salads versus meat and processed foods, drank more water versus not drinking enough water. Is that I started paying attention to these baseline situations with people. And at a very young age, I had a beef against the system in every way of seeing what professionals did in the world, because I always felt like I was bullied as a kid and I never had the opportunity to educate myself because of finances or support from my family. I've been on my own since I was 17 years old. And so I always looked at medical professionals. I always looked at every professional out there and said to myself, I don't need to learn any of this kind of stuff. I'm going to learn my way as a person and just get into as many different fields of work as possible to learn, as an apprentice through, the tapestry of life through other professionals. And so the one thing that got me to at an early age was to learn about people. And so I worked in retail. I worked in the food industry, and I got to know people very well. And because of that, when I was about 26 or 27 years old, I had been scouted by some professionals that I used to drive around in Toronto as a professional limo driver. And these professionals were creating a longevity program in Toronto called the Beresford Heart and Health Center. And one day they said to me, hey, Lamont, how would you like to help us with this clinic? And I said, well, I'm very well versed in what I'm doing for a living, driving this really great car, wearing beautiful suits and meeting really interesting people. Why would I want to work with you guys, honestly? And they said, well, from us getting to know you, you have a lot of knowledge, not based on education, but life skills. And we'd love for you to be our supervisor. We'd love for you to be the concierge of the program. And back then I was honored, because here I was dealing with an allopath medical doctor and a naturopath. And I knew enough back then because of my, studies around Dr. Hawkins, orthomolecular psychiatry and differences in kinesiology through powers versus force, and learning about meditation and certain things, that there was a big difference back then between a naturopath and an allopath. Now, even if the people didn't understand the lining of the financial pockets and the discreditations and the certain ways that the pharmaceutical companies were leading these naturopaths, I could already tell that from a societal standpoint, the citizen, the average person, still believed that a naturopath was more natural than an allopath, okay? But then I started to see that this naturopath was prescribing vitamins and minerals based on certain laboratories that were carried at Shoppers Drug Mart, and certain other of these systems that were in place to enslave the people through these medicines that were basically, rocks in a bottle with flavoring and food colorings. That's what I was seeing. And I won't name the companies here. I'm sure we know what they are. They're all the pretty colors that are right within our eyes on the shelves at Shoppers Drug Mart as the vitamins and minerals. And so what I was learning, though, was the ability for an allopathic doctor and a naturopathic doctor to work together, to take a look at the blood work, to teach at least how to eat better. And I was very impressed, because I was seeing the changes. As a concierge, what I was doing is I was the one inputting the reports of their diet logs for a week. I was the one paying attention to how their exercise programs were doing. I was the one looking to see the interview process of how they were doing better every 3 months, every 6 months, every year, and seeing how their memory tests were doing through the H scans. I was able to see how fast their reflexes were. I was able to see what their lung capacity for their VO2 max was in the trainings. So I could see what these guys were doing. And you know what was doing more than anything was how they were eating, how they were not eating fast food, how they were exercising, and how they were training their brains through these programs that they were using on the computers, how they were reading, how they were increasing all these things. So I was able to see that at a very real world level. And then I understood what chelation was. Okay. Nobody say, and like Steve just said, I'm not going to get out there and say everything, right? I'm not going to be what was the word, Steve? Once again?
Ultransist. I'm not going to be ultransist one-sided.
Yes. Right. One-sided approach where basically I was able to take a look at, doctors are just this, naturopaths are just this. There's nothing else going on between the middle. And what I was going to say was chelation. Not everybody understands what chelation is. It's not just for patients that have to rid their through a dialysis kind of machine. This is like dialysis for blood. And this is the great way for me to be able to not be a doctor is I don't understand all the terms, but I do understand it in a way to be able to explain to somebody who has absolutely no idea what I'm talking about. And so people understand what dialysis is, right? But here's chelation, which cleans out the blood, okay? And I think there's going to be a lot of people very soon that are going to need some blood cleansing from some of these, what are they called? Experimental injections, right? Gene therapy, whatever they're called. And so I was able to learn in a very quick time. I was able to learn what raw veganism was doing to the body, right? Veganism is one thing, raw food is another. I was able to take a look at Herbert Shelton, the juice doctor, and how he almost died from cancer, but then how Dr. Michael O'Brien from Avena Naturals in Red Deer, Alberta, was able to come and visit his good friend, Herbert Shelton, and jam him full of enzymes and probiotics and turn around his cancer in 6 weeks to 7 weeks. And he went from stage 4 cancer, stage 5 almost, where he was like basically his bones were, his limbs were about the size of my finger, basically. And in 7 weeks, he was hiking in the mountains. 7 weeks. And see, those are the kind of things that blew my mind. And so what I said to myself was like, listen, I'm a 51-year-old guy. If I ever want to get into medicine or if I ever want to get into these healing modalities, they will be in a way where I can honor my friends such as you people, right? To do the jobs that you did. You guys went into your specific fields because that's what you felt your life was going into. I'm not that guy anymore, right? I am the resistance movement guy. I am, for example, our good friend Alish downstairs here as one of our attendees, for example, is met him during men's work, right? Men's support advocacy, right? So that's what I do. I've gotten involved in plant medicine ceremonies, right? Which were absolutely incredible and groundbreaking in my life with Helen. We've done some plant ceremonies, which were absolutely amazing. So I understood what medical intuitives were doing. I understood what psychics were doing. I understood what past life regressionists were doing, right? Past life regression, being able to help the person get themselves into a meditative state and actually see their past lives, explain why they still kept making the same mistakes today. Because they were dealing with past life regressions, dealing with you always got yourself stabbed. You always got yourself stabbed during battle. 2,000 years ago, you were in a battle and you got stabbed in your shoulder. When your ex-husband who abused you 50 years ago in another life kept hitting you in that shoulder, and all of a sudden what's going on here is that it's coming emotionally into this area. What's going on here, and what can we do by eating better, getting ourselves involved in the frequency of the body through homeopaths and Bowen therapy, right? Essential oils. And hitting gavels as judges.
Yes.
What are you saying there, Parvin? Say something, girl. What are you
Thumbs
saying?
up.
Oh, is it?
Just keep going. When just keep going. When Dr. Nawat's, Mr. Nawat says time's up for her, she takes 3 more minutes.
Right.
Not 3 more minutes. Because
Good point.
today, maybe, because we
It's a
want to
joke.
talk about immune system.
Mhm.
So we have to have enough time to go over the immunity. That's what we want to offer
Okay.
people. And at this point, I know you guys have a lot of knowledge around everything, around natural domain, but today specifically is about immunity and immune system. And I would like all of you to share what you have to offer in terms of immunity that people can learn from you.
Mhm.
So, because I have a lot to say as well about immunity, as I always do. So, I'm going to pass it to Dr. Grant. If you have, have any form of, protocols or anything that you want to advise people for immunity.
Sure. I fully agree with what Lamont was saying and Helen was saying, and also Dr. Steve and Dr. Parvin. And I agree that fever is not your enemy, it is your friend. Why? Because when the temperature increased by 1 degree Celsius, your body is able to actually heal. In fact, I've been using for almost like 20 years now something called thermotherapy. Thermotherapy is really the best modality to help the immune system. So I've been actually doing lots of research on this. I published about 20 papers on the thermotherapy, and I presented this thermotherapy at the International Conference of Pain in Chicago, 2015, with Johns Hopkins, Mayo Clinic, Cleveland Clinic, and Harvard. My basically presentation was on how the thermotherapy helped to reduce inflammation, as Dr. Steve was talking about before, and help to help the body to enhance thymus health. Most physicians do not talk about thymus. This is the area, this is the organ that actually produces T cells, NK cells, and utilize any offenders, whether it's virus, whether it's bacteria, whether it's anything. So this is the area that's been ignored. And then we've been talking about thermotherapy a lot. And we've been talking about simple things that we can take ourselves, like vitamin D, unlike what they recommend. Most physicians recommend about 1,000. I take and I recommend 10,000 IU of vitamin D3. This has been proven scientifically in so many an area of research that has helped to boost the immune system and to help to counteract any attack of virus, bacteria, and so on. I agree also with Dr. Steve when he said about the fever. Given antibiotics is not the answer because it will kill actually the friendly bacteria. It will destroy probiotics, prebiotics, and postbiotics. So any physician who have still anything left in the gray matter should recommend with antibiotics, if it has to be done, another form of probiotics, prebiotics. Otherwise, you're going to end up with gut dysbiosis. You're going to end up with gut this dysfunction, and gut health, we all know it's brain health. So this is one thing that we have to understand about the link between anybody recommend OTC medication like aspirin, for instance. Most people do not understand that aspirin actually affects prostaglandin, leukotrienes, and it causes thinning of the blood. It causes actually bleeding. So we have to understand risk and benefit. If the risk exceeds the benefits, then I'm not going to use that modality. What is the risk of thermotherapy? What is the risk of using probiotics, prebiotics? What's the risk of using vitamin D3, 10,000 IU, between 8 to 10,000 IU? Vitamin C, 5,000 milligrams per day. Zinc is the most important mineral for the immune system. 80 milligrams, 85 milligrams per day will help to boost the immune system by almost 50%. And then tapping, EFT tapping on the thymus, help to produce T cells, NK cells, and to increase WBC, white blood cells, and neutrophils, and all of the IgG, IgM, all of the immune system modulation that we all need. So on the academyofwellness.com, I developed 10 questions called Wellness IQ/EQ. Those 10 questions explain what Lamont was saying, what Helen was saying, Dr. Parvin and Dr. Steve was saying about what we eat, what we do not eat, and what's eating us for stress. It will determine quantitatively. And by the way, those 10 questions agree with CBC blood test. And the new device that I use right now, and actually Dr. Parvin has the other older device, which is called the biofeedback bioresonance device. The new device now called the AO scan, it gives you actually a complete understanding of the body, about the complete understanding of the immune system in it, and adaptive immune system. It will test for the thymus, it will test for all of the stuff. It will give you a printout equivalent to MRI, CT scan, PET scan and X-ray correlated with CBC blood test by 95%. So who wants to have MRI with all of the injection and all of the stuff that is potential carcinogens? And I totally disagree with the gene therapy, because I have met some clients, especially young ladies, who have clots in their period, and then they have also frequent bleeding, and we help them to clear out the graphene oxide and the spike protein, and to reduce the C.H.S.CRP, reduce the galactan-3, reduce methyl peroxidase, all of the inflammation marker that Dr. Steve talked about, that we can actually help to modulate that and to control free radicals because of this gene therapy. And by the way, the experimental study done by the FDA, I'm not against that, but right now, once they finish that experimental study in a couple of years, then we'll know if this gene therapy is effective and is safe or not. So does anybody want to take a chance waiting for 2 years to see if this has been given to 80% of the people safe? So it's experimental. It's an experiment for humans, especially as Dr. Parvin saying, young infants. I don't think it's worth the risk. I do not believe personally it's worth the risk. But if anybody have any problem getting the double vaccination, I am part of one large US company, and I'm one of the scientific advisors to produce a new stem cell patches. And those stem cell patches actually destroy and remove all of the spike protein, all of the graphene oxide, all of the side effect of clotting, thermoembolism from the body naturally, using all of this natural modality here. So we can help people. Like if somebody get damaged by this experimental gene therapy and it affected the RNA and DNA, we can reverse that. It's very easy to reverse it with all of the method that I've been talking about. Unfortunately, I don't have the time to explain to you about all what I do here. However, reach out to me and I'll be able to share that with you, and we can have a very open discussion off the camera, because this thing is recorded. There's few things I can say, but I'm not able to say. I'm sure you understand. Thank you.
Wow,
know.
thank you,
I
Dr.
know.
George.
Thank you. Thank you,
Yeah,
Dr. Brand.
wonderful.
Yes, yes. So anybody wants to go next, or I can continue with the immunity. Okay. I would like to have a little bit of chit chat on why this many viral infection is happening around the world in the past many decades. What is the reason? Because nature created a microbial triad association. We all know that. There is like a triangle with bacteria, fungus, and viruses. So viruses, this association, I call it microbial association, they have to be in balance in terms of numbers. So this association has 3 members. The viruses, they're always under control by bacteria and fungus. So what is the reason that there is so many flu infection? It's the last, I don't know how many decades is happening. It's all the result of excessive intake of antibiotics.
Yes.
Excessive antibiotics that is killing, as Dr. Steve and Dr. Grant also said, it's killing life.
Yes.
It's killing all the good and best bacteria in the whole body, because antibiotic is not biased and does not discriminate. When it gets into your system, it's going to kill all form of bacteria with the bacteria kind of form and shape, different form and shapes. So this excessive medications, and also the other suppressive medications such as cortisone that has been skyrocketing, and also flu shots.
Yes.
The flu shots that is happening the last 30 years. If this pharmaceutical suppressive medication, and now on top of everything, the vaccines, that whatever did you call it? You know, I like to call the original name. So has upset and interrupt this triad association. So that's why the viruses are growing, because there is no enough good bacteria in human body anymore. This triad is disturbed and is out of balance. So virus can dominate this microbial triad. So as a result, for the natural innate immunity, what can we do? There is no problem with the natural innate immunity of human beings. So the nature is endowed this innate immunity, adaptive immunity, passive immunity in every single human body with no exception. But what is happening the last, several decades? That's the only, I think, problems behind that. So,
Thanks, bye.
Okay, so we all have, the immune system is a sophisticated machine. It's a sophisticated defense mechanism. We have innate immune system. We have two subsystems. One innate immune system, as we all know, is our skin, is our mucous membranes, is our respiratory system, and unfortunately, every single innate immunity part is being suppressed by this suppressive model from birth to now. So adaptive immunity is not supposed to be activated when the innate immunity works. So unfortunately, the artificial vaccination, artificial inoculation, directly bypassing the innate immunity, underestimating the innate immunity, does not allow the innate immunity to awaken, does not allow the innate immunity to kind of be vigilant, and also the communications and coordination and collaborations within these two subsystems that we are born with it is completely disturbed and shut up by this artificial inoculation. There is a sophisticated pathway of communication between these two subsystems. We are born with it. We don't need to kick into adaptive immunity. Even naturally, it does it on its own. If the innate immunity is in a state of that, no matter what, if it's a state of weakness or whatever, it always rings the bell. There are macrophages, there are different kind of white blood cells that they're collaborating, communicating between these two subsystems. If any pathogen that bypasses the innate immunity, it rings the bell and immediately sends a message to adaptive immunity to mount an immunological responses. So, but do we need these complex immunological responses from adaptive immunity? Absolutely not. If our innate immunity is at a state of health, we don't need adaptive immunity. And when it comes to artificial stimulating adaptive immunity artificially, is an absolute shock to this communication. It just leaves the innate immunity, which I call it border patrols. I call them, these are our soldiers, and at any given moment, they would die for us. They are the frontliners. You don't care about them, and you step over them and bypass them, and artificially you're going directly to adaptive immunity by artificial drugs in order to stimulate adaptive immunity. It's a death installment to me, because sooner or later, first of all, the very first moment we face compromised immunity, because innate immunity has to compromise. And I always say in my teaching that innate immunity is like a border patrols, that they are our soldiers. They are on the first line of defense. They're also always facing the outside world, that any foreign materials that is non-self, because they know it by heart. They are programmed and designed for it. They know it by heart. Any form of pathogens from this association, it does not discriminate. They know it by heart, that as soon as they're passing the border, they know it. They have the immunological response to kill them, to attack them, to repel them, to kill them. That's their job. They don't need to learn anything. They don't need to adapt anything. But unfortunately, with this model, This innate immunity is been bypassed. This innate immunity is been dormant for decades. This dormancy is passed to the infants, is passed to the babies. That's why we are having crisis with children now. A lot of infections. So that's what I wanted to talk about. This communication pathways has been disturbed, and in so many cases has been shut off. That's why people that they had COVID, whatever, inoculation, they keep getting COVID. They keep getting infected because their innate immunity is completely dormant. It doesn't care anymore, you know. And these are living entities. If you step over them, if you underestimate them, if you bypass them, so they're gonna stay dormant. That we can see it, and start with compromised immunity, then sooner or later autoimmunity, and goes on and on. So and I pass it to somebody else to talk, and if there is any time, then I can kind of talk about my protocol treatments for immunization. Helen, would you like to invite somebody else to talk? Or any questions?
I don't have any questions per se at this time. You know, it's very great information. The only thing to add is, you know, what you shared about antibiotics. You know, it does kill off all the good pathogens and the bad pathogens along this way. And a lot of people need to find a very good probiotic to actually help to recolonate that again, right? And what Dr. George Grant said, it is the brain and gut barrier and communication balance that needs to be done. Without one, the other won't even be there at all, right? That's where the miscommunication comes in with the you know, with pathways, and also other things that's actually helping to, you know, to bring all these good pathogens down is what we've been eating, you know, stress in the mother fact, you know, chemicals is in the air. You know, we've been sprayed. It's been a history back in, I don't know how many years, but over like 100 years or so, DEET was sprayed, you know, openly and upon people that they trusted their government, you know. And then finding someone, I forgot her name, but she wrote a book about it, and they went against her, saying how DEET was sprayed upon how it's affecting individuals, that they didn't believe that. So it's in the system, it's in the DNA, right? Because who we are and what we go forward with, we hold it in the DNA, and it's up to us to wake up and clear whatever there is that doesn't serve us in this time right now, sort of thing, to move forward in a better way.
Yeah, when it comes to antigen, antigen can be any pathogen, any microorganism, or any form of toxins, internal toxin, external toxin, and or any food particles that does not agree with the person, causes allergy or sensitivities or intolerance. These are all parts of the, you know, creating immunological responses. So it's not only the pathogens. So that's why I want to add. Dr. Grant, you're going to say something.
We have to support our microbiome and virome, because we got trillions of bacteria and virus inside our gut that needs to be fed properly. Even if you eat like sauerkraut and kimchi and kombucha and all of the stuff that help to produce a healthy microbiome, of course, taking the, you know, the vitamin D3 and the zinc and all of the vitamin C, resveratrol, quercetin, all of that natural, you know, probiotics, prebiotics, postbiotics, and all of the stuff that we're talking about here, that support healthy immune system. We have to get back to basics. We have to get back to eating the right food,
simple food
at the right time, and that's what you mentioned, Dr. Parvin.
Yes, I completely agree with you, Dr. Grant. But there are two different forms of immunity, right? One with food, one with supplements, and whatever you say. But there are times that people need immunization. Immunization is different than supporting the immune system. Yes. We support the immune system on a daily basis with the right food, with, you know, supplements if we need here and there. But when it comes into immunization, I don't want to be biased about anything, but the only and only immunization is by homeopathy, because the vaccines originally is created through homeopathic principles.
Yes.
So we have everything out there to boost and fortify, to help immunity when there is no problems that on regular basis. But there are times that we should, which I have been doing in my practice for the last 24 years, with 22 years, sorry, with homeopathic no-sots. So that's, I think, the only way to replace this artificial inoculation. Actually, there is nothing to compare it. But the one thing that I would like to say in regards to homeopathic immunization with no-sots, because these teriad, the bacteria, fungus, and viruses, has to come under right ratio. If we don't bring them under right ratio, always our immunity is at risk.
Yes.
So, but then with probiotics, prebiotics, or whatever, we help this teriad to be healthy for sure. But immunization is whole different concept, right? With homeopathic medicine. One thing that I would like to know, whoever listened to this, that homeopathic immunization is not a vaccination, We work directly on innate immunity. We do not touch adaptive immunity, because adaptive immunity has to be start working if innate immunity rings the bell. If innate immunity send a message, they need more complex immunological responses, then adaptive immunity comes to help. Otherwise, innate immunity is our survival, is our border patrols, is our first line of defense, and is our main innate immunity. That's why I always say just work on that, on regular basis with food, and try minimize the exposure to toxins and everything. These are something that definitely support the immunity. But on the other hand, every single person, especially around this time, that viral infection is skyrocketing because they disturb the teriad around the world. Everybody should go through these immunizations every 6 months. Depends on their how compromised their immune system is. Patients come to me that I do immunization every three months. Some that they just need once a year. So at this point, I highly recommend everybody to do this. If you know any homeopath close to you, or anybody who does homeopathic no-sots, just go to them and please start doing innate immunization right now. Otherwise, the worst is yet to come. Thank you.
May I just add one thing?
Yes, Steve, go ahead.
Okay, as I told you, I work basically a lot with essential oils.
Oh, great.
Now, to understand the essential oils, it would take time, but we'll have time for that. One thing I have to say, essential oils have been created by nature to defend the plant world against bacteria and viruses and fungi. And they have an innate knowledge within these essential oils that they go and destroy bacteria, fungi, and viruses that are harmful, but they leave the bacteria, viruses, and fungi that are necessary for plant life. And science has demonstrated that that is exactly what happens in our body. Now, let's consider one thing. I agree 100% with what you say, Dr. Parvin, but I also say, besides the fact that when we talk about antibiotics, let's not forget antibiotic ingestion through food. Let's not forget about all the chemicals.
Yeah.
And let's not forget one other thing. To my knowledge, when you, in a laboratory, create a vitamin A, you also create an isomer, which is exactly a mirror image, okay, of the vitamin A. But this image is a toxin for our body because our body has no knowledge on what to do with it. So when we start using things that have a synthetic or a laboratory origin, we are creating the basis for a major inflammatory response. Now, that is going to make our frontline soldiers respond. But sooner or later, our frontline soldiers are going to lose force because they have to respond to too many things. They have to respond to stress, they have to respond to food, they have to respond to toxins, and so on. When we talk about fighting off viruses and bacteria, I'm sorry, but science has demonstrated that we should really start addressing as a complementary approach the use of essential oils. Not because the essential oils are antibiotics, but on a very fast way of explaining it, bacteria, fungi, and viruses have a membrane.
Yes.
The essential oil penetrates the membrane, and when it encounters a bacteria that is not symbiotic to our body, it destroys the membrane of the fungus and the bacteria. But for the virus, nature is much smarter. Not only does it destroy the membrane, but it starts impairing the genetical part of replication of the virus within the cell. So I have started way back when, about 20 years ago, and this naturally depends on the quality of the essential oil. It has to be 100% pure and so on and so forth. I've started treating many intestinal problems with the ingestion with naturally gastro-resistant capsules of essential oils like thyme, oregano, rosemary. I mean, rosemary, for example, is able to kill 90% of gram-positive and gram-negative bacteria. Exactly. Yes, exactly. And this also has one other big advantage, which we do not consider many times. You were talking about the brain gut. Essential oils also modulate the connection of the brain to the rest of the body because it modulates a lot of the physiological reactions. So you're going to work on both areas. And at that point, once you get, for example, I work on that a lot with Candida, dysbiosis, and other problems. Once you get that in balance, you're going to start seeing major results when you do prebiotics, postbiotics, and so on. Plus, if you start adding essential oils of the citrus family are highly antioxidants. And if you put them in the capsules along with the oregano and whatever, you're going to get a disinflammation of the internal mucosa of your intestine, which means your villi are going to start from being like this. They're going to start to open up, and we're going to start getting an intestinal function back. Now, this is how, when we say essential oils help the immune system, because it works. They're starting to see now that various essential oils, cinnamon, thyme, oregano, and a couple of others, also modulate the macrophage response and so on and so forth. But it helps the body to, let's say, stop the aggressors of the front line. So at that point, your immune system is able to respond better. And this is the basic essence. Therefore, when I talk about using essential oils, it's actually to give support and to help our body have something that distinguishes what we need and what we don't need. For example, when we talk about viral infections of the lungs, I'm sorry, I don't use anything else than essential oils on a respiratory base, because it goes and effectively eliminates the virus by dismantling the membrane, inoculating the part that is the replication, and our body, therefore our frontline immune system, can start reacting 100% without having to overreact. So this is what I've been doing, and it's part of a lot of success, and it's very, very simple. So, and it can be used, and we've discussed this many times, you, Dr. Parvin and I,
Yeah.
along with homeopathic therapy, as long as we keep them separate. We keep them apart. I'll use essential oils, and then I'll set up the nosode system. Okay, but I will not use them, for example, in this case, I will not use them together.
Oh, no.
I'll do one step and a second step. It's a preparation, helping, and you get a higher response, even in people who have many, many problems, and their life vitality is low. And then one last thing I do want to say is, and this is something we all know, but we don't address that much. Let's not forget the spiritual nutrition. I come from working with Native Americans for over 18 years, and the spiritual nutrition that we can give our body to help it react and regain solidity on vital energy and vital reaction is something that many times I have called miraculous. Thank you very much.
Yes,
Great.
thank you so much, Dr. Steve. That's part of the immunization. To not to wrap it up, just to put our approaches in order. I think the prebiotics, probiotics, too, that Lamont said, Dr. Grant said, comes first, always, for to have a strong immunity. We cannot deny that. Then immunization on the top, and the immunization has nothing to do with any other approaches. But during immunization, it has to be away from any other approaches. So during the 6 weeks immunization with nosos that I do, I ask everybody to go off anything they have, and not definitely they should have food, but I mean any other form of treatments. So after 6 weeks, definitely essential oil is kind of maintaining and normalizing whatever the immunization has done, to my understanding. So I mean, we are all, our approaches are compatible in order to bring the innate. We're all working on innate immunity. None of us working on adaptive immunity because we are not pathogens, right? And plus, one more comment I would like to make. Our entire body, within and without, is covered by millions and millions of pathogens. I mean, microorganisms, but not all of them are pathogens. Not all of them they are disease, kind of creators. So whatever they create diseases. So a lot of microorganisms that they are in ecosystem and they are helping actually us to digest, to assimilate, to so many things. And even the biology science still doesn't know much about it. But if I die in the next moment, the very first thing I'm going to be eaten up is by viruses from within, there's a microorganism from within. So that's the reason that we are alive is our immunity, is the dynamic entity, and we should have, take care of that on every single moment. So you guys are awesome, and that was just wonderful. Anybody, anything wants to say? Lamont, I think you're waiting to say something.
I know I look like I'm always waiting to say something.
Yes, say it.
I think for the first time in my life, I am so pleasured with the fact that there are educated professionals here that can talk to real science and real data instead of just trying to hear myself talk so I fill the void. I really appreciate that.
Oh, you are
because-
part of us.
Well, because what I was trying to say before was, this is the disconnection and division of what's been happening for the last 28 months is that, either you're in a symposium conference where you talk your sciences, or you're people that get on Zoom calls because you're talking about how to bake a cake and drink too much alcohol, or watch the latest show that means nothing. And I don't do either one of those, which is why, when everybody started asking questions as to what the hell was going on 28 to 29 months ago, I said to myself, well, I don't know what's going on in the streets. I don't know what's going on with the science. All I know is that for the last 20 years, I've been researching the fact that there was an agenda coming. And like Steve said, and like Professor George said also, is that there's an economic bamboozlery going on in what these pharmaceutical companies are trying to say. And I go one step further, which is getting into the conspiracy theory area, which I will keep away from this show, which is more dubious and nefarious. And that's why I'm here, because I want people to understand when they see these shows in the future that we're ready to start talking about this kind of stuff. Okay. There's a lot of education that people don't understand, and they always have to segregate themselves from medical authorities because they've been led to believe that they don't know enough, that the doctors always make them feel stupid, and they always get them out of the office fast enough with a script because they don't really want to hear your life story, and they don't want to get to know you. They don't want to talk about your problems, and they don't want to talk about what might be the issue. Oh, my husband was beating me last night. And for the last 20, 30 years, because he's an alcoholic, maybe that has something to do with why I have acid reflux. Maybe. Geez, I don't know. I can't sleep. Why? It's not because you're missing a drug. It's because you're beaten every night for 20 years. Maybe that has something to do with it. So I think we've lost the connection between those medical professionals. And I can tell you one thing. This agenda is teaching people one very important point. That industry is done.
Done.
They're
We are
done.
the healthcare now. We are the health. We claim it.
You see this? Where's the symbol here? It's the Spartan helmet. Okay, it's upside down here. People now have the spirit of Sparta in their minds. And when they see people with beautiful spirits and hearts, that's who we protect. The other ones that have been leading us down this road, where now we're in a situation where people are being socially distanced instead of, or physically distanced instead of social distancing, is that, like you said, Steve, they've separated us to a point where the tribes and the animal kingdom, those animals, those ants, those insects, those birds, they die if we don't get together. They die if we don't hang out and talk about these things. And this is what's happening right now, is that we're able to now talk about it, get ourselves together. And it's not just because we want to hang out. It's because our lives depend on us as a species. And yes, we are authority figures based on what we know that we've basically put our lives in line for. You have all gone to school and learned through decades. You've taken the arrows. Manon, for example, deregistering. Parvin, you being your life being threatened, having to leave your country with your children. Like, you guys have taken the hits, and it's for people like myself, Helen, Alish, Joan. We are people that want to protect you guys no matter what, to make sure that your knowledge is what the next level of people in history, our children, our society, understand before you're taken out. Because these people, they will stop at nothing. Yeah, they can, click off our Zoom links and stuff because that's the easiest thing to do. But if we keep talking the way we're talking, and these people don't get taken down, it's going to get very dangerous for us. And guess what? I don't think any of us got into this, or I don't think any of us stayed in this because, we understood they weren't dangerous.
Yeah.
Okay. And you people are the people that, well, you're family now. And I'll die for
we
you
are
if I need
family.
to. We've got your back. And I just wanted to say thank you so much.
Thank you.
Your knowledge and your experience is something that we can never let go.
Yeah.
And we're here for you.
Thank you, Loman.
Thank you very much.
I think, just make a comment here. I know that the past 29 months, because Lamont is always accurate about this, the length of what's happened, the whatever the show that happened.
It's like a baby. 29 and a half
29 and a half months. Even though brought the fundamental darkness of the human beings out, but it's serving humanity on another way, honestly, and because the scam science, their fake narrative, and their deception, corruption at all levels is out. The truth is out. If some still don't want to believe it, it's their problem.
Up to them.
But we all know that the science fiction, the scam science has already been revealed, and it's serving humanity. And honestly, the reason that we are all here is not for ourselves. We have access to everything. We have access. I personally have access to the best system of medicine. It's affordable for me. It's available for me, for myself, for my children. But I'm here for the others to know that what is the best for human being. You are the same thing. That's the reason you're here, because we are liable for our next generations. The past generations did it for us, and it's our responsibility and duty as a human being, and also under oath as a practitioner, medical practitioner. We are responsible to speak out, to speak up for our next generations.
No.
You see this? That's why whatever happens, they call it pandemic, whatever, to me, served humanity to understand every aspect of lies and corruption and deception. And that's why we are together. That's brought us together. What's more beautiful than this?
Well,
I didn't know. Yeah.
You know one thing, Dr. Parvin?
Yes.
This goes way back in storytelling of the Native Americans and other Native tribes. It's not only Native Americans. When you ask them, why are we here? They say, we're here to protect Mother Earth.
Exactly.
And to leave it much better for the next 7 generations. So you must decide, what is the legacy you want to leave for the next 7 generations?
Exactly. Absolutely.
And that's what brings us all together.
Yeah. Dr. Grant, I hope you're still there. So Dr. Grant and I, we've been part of one organization for years, and we were part of the international conference for years, both of us. And we were faculty member of the one college together. So we were the same department. And we had conferences after conferences after conferences to bring natural medicine to people. And it did not work. It doesn't work that way. But whatever happened the past 29 months, whatever we did that did not work, now it works. So that's the reason that I say that darkness came out, brought the truth out, but it worked the way that we work as a commitment, But I don't mean that it was wasted, but it's no longer going to be wasted. Dr. Grant knows how many conferences, one after another, lots of conferences. Yes. How many retreats? We had a retreat. Do you remember the retreat together?
Yes. Yes.
Dr. Grant and I, we worked so closely together. And Dr. Grant, do you remember the feedback or what we got out of it? Nothing. We were just a bunch of professionals together. We shared. But this, whatever happened, we went through so much darkness for sure. But for me, I always saw the lights, the end of the tunnel. And even at my speech, Lamont knows, I said, we are holding the torch. That's the reason I say we are the healthcare. I'm not saying that we're going to go to hospitals. We're not going to go to hospitals. Hospitals, it's for emergencies.
Yes.
Hospitals is for trauma cares. Hospitals is for surgeries, not for people. For healthcare is your home. The same thing with Dr. Steve said, spiritual nutrition. I absolutely agree with you. I'm an Orthodox Buddhist. So on daily basis, I do my prayers. That's my nutrition. That's actually my first nutrition. That's what I start my day. I don't start with breakfast. I start with my chanting. Chanting is my spiritual nutrition. And that's why, I am at this age. I don't want Dr. Grant, don't ask me or my age. Once you asked me, and I got so upset with you. You came to my office and asked me, Dr. Parvin, how old are you? I said, what? How dare you ask a woman now what's your age is?
We all know that you're 35 or under. We all know that.
I said, no, you said 31. Do you remember now? You added 4 years. Back then. So we plan to work in the same office too. And I also, Dr. Grant asked me to be a co-author with them. So we had, kind of collaborating from a long time ago. But what I'm trying to say, when I say healthcare is your home. The same thing with nutrition, spiritual, it's your temple, it's your sanctuary, it's your wherever you're releasing yourself from physicalities, and you're becoming way more than who you are at the physical dimension. So this is something that we never ever forget. I think all of us, with different tools, with different mechanisms, we're trying to come out of physicalities. So that's the best nutrition you can give to your system. I know Steve also is, Steve and his wife both are spiritual. I know that. So at this point, again, nutrition is not only one that what you're putting in your digestive system, in what you're putting all your cells from all different dimensions. So yeah, we are the future healthcare, and we got started. And I want all of you be part of the healthcare. I would appreciate all of you to be part of healthcare. And Dr. Steve and Dr. Grant, I would love to invite you to be part of C.N.H.C.
Yes.
If you like, absolutely. Helen, please add Dr. Steve and Dr. Grant to our team. And from now on, we like to have these two bright, professors in our team, and the whole world is going to benefit from them.
Yeah, I agree with you. They come with quite a vast knowledge in different areas that people can understand, and also get a little more education upon as we go a little deeper. It is 2:00. I think Lamont has a call at 2:00. Lamont, is there anything you have to say before you have to go or anything,
Sure.
sir?
Yeah, I do have. Thank you for reminding me, Helen. And I just want to say that, based on this approach, ladies and gentlemen, it's perfect this way, because first and foremost, it's about a life experience. Okay. And as we delve into these new subjects for all aspects of healing, I think it's great that you all have your specific learned techniques. However, as we head into these specific topics, is that you'll always be able to come in. For example, I'm a water knowledge guy. I'm a water guy. I know water very well. So whenever we get into areas where I can inject some of my experience, then terrific. And what's going to happen with each time we do a show here is that we'll all have our way to connect with the audience in a way where they can see the greatest piece of wisdom that you have to offer them. We never know where those nuggets are going to come out from. But as long as we can have this new way of doing these shows where we can bridge the gap between that holistic learning and the very targeted approach of where your expertise are, you'll always be able to give, some information to the people for specifically what they need to know and hear during each individual chat that we have here. So I just wanted to say thank you so much for being here. Thank you, Parvin. You are always a wealth of knowledge, and your friends and contacts and family are, I'm never surprised by the beauty that you bring into the whole works here.
I want to say that Lamont and Helen, they are chief ambassadors of C.N.H.C, and Dr. Steve and Dr. Grant, they're new now. So if you hear from these two people, they are the ambassadors. Please just,
we're here.
Collaborate.
We're here for everything. Anything you need.
Naturally give them my contacts.
Yes, can you please type could you please type in the chat your email address? I'm going to copy it down and add you going forward. That'd be wonderful.
Yeah, because the
Can't wait
chief
to see it.
ambassador is communicating with all professionals across Canada and around the world. So when you hear from Lamont and Helen, you know that they are the ambassador of C.N.H.C.
We've got your back. There's anything you ever
That's my
need,
personal.
give us a call,
Awesome.
give us an email. We're
Thank
there
you.
for you. And you know, we're creating a community, an international community. It's not just international anymore, it's universal. And so we have to get ready for contact with the others, interdimension, and that'll be for another chat some other time.
Yeah.
Thank you so much. I have to go.
Thank you,
And,
Lamont. Appreciate it. So
we'll see you soon.
Thanks, Lamont.
Thank you,
thanks,
guys.
Lamont. Have a nice
you very
time with your
much.
mother. And
Yes.
yeah,
You'll meet
yeah,
her soon.
have a wonderful
And
time.
thank you, Alish. And thank you, Joan, for once again being.
Alish, yes.
Thank you for holding the field.
Alish, thank you so much for joining. It's always a pleasure to see you. Alish, can you hear us?
Yes, yeah, I just had to
Oh,
unmute.
yes. Would you like to say a few words? Would you like to say something? Because you've been quiet all the way.
Well, yeah, just a couple things. I mean, it's very refreshing. Just in the past couple of years, I've decided to. I think I had this basically this belief that I could go to my general practitioner and talk about all these cool stuff I was discovering about natural health, and I'd always get basically it was like stunned by their just how they believed what they believed in, and how but like dismissed and mocked and all this, like I just felt dismissed, and but now that it's very refreshing now that I'm hearing other people, and I'm basically I've decided to reach out more to different types of practitioners. Like it's like an exhale. I can exhale. I'm like, I feel home. Like we're talking. I can't talk to my doctor about God, spirituality, like natural health, and I'm just learning a lot too. That like I'm learning from you guys, and actually, that's what doctor actually means in its original form is teacher. As far as I understand, I mean, and its etymological word means teacher. So, and I don't learn from my GP, but I've learned so much from you guys, and yeah, I'm excited to learn more about health and like the thing about innate and adaptive immunity, and so I was just taking notes today because
Great.
there's still so much to learn about my body, and I guess one thing is like with that model, although I agree with Steve about they're like about the integrative approach, like both Western and Eastern medicine have their part to play, although I guess they've overplayed their hand in the last couple of years, and I don't know, I guess I have a lot to say. I'm just I'm excited, yeah, it's great to be part of this.
Yeah. Thank you so much, Alish. It's always
Great
great
to
to
hear
see
you.
you. I know Alish from all the rallies in Toronto. Yeah, it's great to see you. So we are science where meets wisdom. So the science without wisdom is destructive. It becomes a scam and fiction and brings always fake narratives. And plus, science is not created by anybody, that they own science. They say we own science. Science is always is endowed in nature, and every single it's information, it's knowledge. Nobody invented science. Science is the knowledge, proper knowledge of how universe behaves, how nature works, and how human being is an absolute part of nature, and you just have to discover it from in a nature outside world, and also download it from inside world. So that nobody owns the science, it's only wisdom. Your wisdom can own it, and by downloading it or discovering it. So what they say that I heard in some links that I don't want to bring the names up. You know, I'm just afraid they're going to bring the YouTube down. They own the science. That's not science. So as I said, science is within us and within the universe. We just have to discover it and download it. And we are here to share our discoveries. We share our whatever information I downloaded on each individual level. Dr. Steve, myself, Helen, and everybody, you know, we have our individual knowledge that is unique to individual. No matter, we all are homeopaths, we are all the naturopaths, but there is a knowledge that is individualized with that individual. That's called downloaded knowledge by that individual. That is unique and is very beneficial, and it's great to share it with the others. So that's why you don't hear that from your doctors. So because doctors are educated, as is a Latin word, right? He's an educator, a teacher. They're not sales agents. So if whoever is sales agent cannot be a doctor, because
So
they
Parvin,
cannot teach you the medication, you know.
so
Yes.
Parvin, I have to go soon. If
Yes.
you want to, shall we wrap this up,
Yes.
or do you want to continue it on?
I have to run too.
Yeah, I think
So-
everybody has to go. We say bye to each other, and thank you so much, Dr. Steve. You're awesome.
Thank
And
you,
thank you,
Dr. Steve.
I'm
Helen.
honored to be here.
Thank you, Alice. Thank you, Joan, so much. Joan is quiet because
Joan is still there.
the communication is one way. Yeah, she has some issues with her PC. But anyway, thank you so much. I appreciate it. And Helen is going to be in touch with all of you for the next campaign, which is going to be our
Perfect.
next campaign. I
All right.
appreciate it.
Thank you
you
very
so
much.
much. Bye-bye.
Thank you guys. All the best.
Bye-bye.
Have a nice weekend.
Bye-bye.
Bye.
Bye-bye.